Good night. You're listening to IRFM, and this is your favorite late night show. It's called Sex Wise. It's Tuesday, July 8, 2014. It has been a very hot day, but I hope it's much cooler for you tonight. And I hope that all of you are safe and contented, whether you're at home or traveling or at work. I'm your host, Dr. Al Bailey. And tonight we are going to have an interesting show lined up for you, because tonight it's call-in clinic, and of course we will be having a doctor on call. And tonight's show is dedicated to addressing female disorders. And of course, as usual, the doctor in house is Dr. Patrick Clark, consultant obstetrician and gynecologist, who will be fielding all of your questions about matters having to do with female disorders tonight. We'll soon open the lines to invite you to call us and share your thoughts with us. So let me remind you that the numbers are 974-3029. And of course, we have to ensure that you call us and share your thoughts with us. And the other numbers are 974-5079, 974-5043, 618-0352, and 1-888-991-4552. Let me remind you of the numbers again. 974-5051, 974-5079, 974-5043, and 618-0352, and 1-888-991-4152. You're listening to Sex Wise, and of course this is your favorite show. It's on IRFM, and tonight we are planning to spend a little while to look at female issues. We've spent the month of June looking at male-related disorders, and I hope that you all found the discussion useful and that you gleaned a lot of information about what men can and should do to protect themselves. Of course, just want to remind you that you can contact me at alphabet@cjamaica.com. That's alphabet@cjamaica.com. And you can give me your feedback at 377-0122. That's 377-0122. And as usual, I must remind you that my book, Sexplanation, is available online and at all your favorite bookstores. And so you need to get a copy of the book and, of course, give me your feedback at alphabet@cjamaica.com. So, we have a doctor in the house, and is none other than Dr. Patrick Clark, consultant obstetrician and gynecologist, who is here to discuss any issues that you have on your mind having to do with femininity. Patrick, welcome to the show.
Oh, thank you. Good to be back.
You look a little sad. I don't tell you more over the match this afternoon.
This was depressing. I couldn't even watch it.
It was hard to watch, isn't it? I actually was at UTech today, and when I was coming down, I listened to it. It was very stressful stuff. You actually watched it?
No, I didn't watch it.
You listened?
I was watching the scores on the computer.
Oh,
until 3-0.
You couldn't bear it.
After 3-0, I said, "No, this doesn't make sense."
Yeah, it was an amazing switch. I think it left the whole world basically.
I was wondering if they were like on go slow or something, or if they were down to 10 men. I mean,
okay. I suppose over the next few days and few weeks, the postmortem will definitely try to unearth what really happened, because it left the presenters speechless, basically.
It did, yes.
Yeah. Well, not to worry. I'm sure that over the next 2 hours, when you begin to feel some questions in your area of specialization, your spirit will be lifted. Mm-hmm. So let me remind you again, you're listening to IRFM, and this is Sex Wise, and I'm your host, Dr. Al Bailey, and tonight it's a call-in clinic. We're going to discuss matters having to do with females, and the numbers are 974-5051, 5079-5043, 618-0352 and 1-888-911-4152. Call us and share your thoughts with us. You know, Patrick, when I was coming, I reflected on an issue which really has me a bit bothered. And I have in front of me here the demographic statistics that was published in 2012. And I was looking specifically at some of the key problems that women in our society have to cope with. And I just found the statistics really alarming. Because when we look at the 10 leading causes of death among females 5 years old and over, the top one was diabetes, followed by cerebral vascular disease, followed by hypertensive disease, then ischemic heart disease, other heart diseases, and then a lot of malignancies. In particular, malignant neoplasm of the breast and malignant neoplasm of the cervix and human immunodeficiency virus. This is very sobering. And in fact, the malignant neoplasm of the cervix is the 9th most common cause of death among women, and that bothers me, especially since it is eminently preventable.
The whole list, everything that you have read is basically a lifestyle.
Absolutely, they're all lifestyle illnesses.
All lifestyle illnesses, so they can all be prevented.
And it speaks to the fact that we are just not doing what is right and appropriate to prevent these things from happening. But let's look at why should carcinoma of the cervix be the 9th leading cause of death in 2014? That's worrisome.
It is very worrisome. If you go back to the early 1900s, Jamaica and the United States and other first world countries probably were at a similar level of cervical cancer in their women, and then came the pap smear. All right, so in first world countries where there, I wouldn't say there's a good pap smear program, because there is a good pap smear program in Jamaica as well, but the difference is that the uptake of pap smears by the women in these countries is very, very good. Right, and so we have moved from a situation whereby the rates of cervical cancer in Jamaica are now 30 times or more that of cervical cancer in the USA,
30 times?
England, or more. And this is all because of the uptake of the women doing pap smears. It means,
therefore, that we are obviously not doing something right. I mean, what is preventing a woman from recognizing the need to do the pap smears? What's wrong in our public relations? I mean, we have a health center in almost every district in Jamaica, and we do have fairly good primary health care. Therefore, why isn't the message?
I often say to women that anywhere in Jamaica, if you leave your house and you drive for 1 mile in any direction, you can find somebody that does pap smears.
There you are.
So it is not availability of pap smears. It is not cost of pap smears. I really don't know what it is. We probably need to have,
as lost for word as a Brazil match.
Need to have another. But we've had them. We've had education programs.
Okay.
And when you talk to women and you ask them, do they know what a pap smear is? Yes. Have you done your pap smear recently? No. Why? No reason. So it is not a question that they don't know that they need to do pap smears. Right? So they know they need to do pap smears. And they have an idea of the frequency in which a pap smear should be done. But they're just not doing them.
Absolutely amazing. You're listening to IRFM, and of course this is a late night show. It's called Sex Wise. I'm your host, Dr. Alverson Bailey, and the doctor in your house tonight is Dr. Patrick Clark, consultant obstetrician and gynecologist from St. Anne's Bay. Call us at 974-5051, 5079-5043, 618-0352, and 1-888-991-4152. Call us and discuss any matters having to do with female and their issues, because tonight is actually a call-in clinic. We started the show by emphasizing that cervical cancer is, in Jamaica, the 9th leading cause of death among Jamaican women, and that Jamaicans' prevalence of cervical cancer is up to 30 times higher than that in the developed country, which really is very worrisome. Now, Patrick, when I mentioned the prevalence, at least the mortality figures, you mentioned that it was a lifestyle disease. But before you respond to that, let me...
Well, all the ones on the list that you read
absolutely
are actually lifestyle diseases.
Okay. Why do you describe cervical cancer as a lifestyle disease?
Well, I was actually referring to the others. But even with cervical cancer, the women who are at greatest risk, they're well-known risk factors.
What are they?
So, any woman who has had more than one partner, and any woman who starts sexual intercourse from an early age. And as far as cervical cancer is concerned, when we talk about an early age, we mean less than 20.
You use the term any woman who's had less than one partner.
More than one partner.
More than one partner, rather. Okay. Now
that's a risk factor.
Yeah, I understand. That suggests that almost all women. Almost. Notice I carefully use my choice of word. But continue, sir.
But those are two main factors, right?
Okay.
The number of sexual partners and age of onset of sexual intercourse.
Okay.
And
about which age is regarded as a safer age to have intercourse?
Over 20.
My goodness, Patrick, that's harsh.
No, it's not harsh. That's not harsh.
Over 20.
That's not harsh. For example,
yes.
If you go back 20, 30 years ago, when I was in school.
Will you point for me, please? We're going to take a short break. We'll be right back.
Vitamals, go for gold contest. Buy any 3 Vitamals. Papa Jesus, open up studio. Come on, no.
We are Calgial.
Say, come on, no.
You know over.
Welcome back. You're listening to IRFM, and this is, of course, your late night show. It's Sex Wise. I'm your host, Dr. Alverson Bailey, and we have a doctor in the house, Dr. Patrick Clark, consultant obstetrician and gynecologist, who is here to answer all your questions that you might want answered about anything having to do with the female. We want you to call us at 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. We have a call online. Caller, welcome to Sex Wise.
Indeed. Thanks for pulling me on board.
Yes, sir. Good evening to you.
Yes. As a man who is conscious and indeed have the concern of every one of our Jamaican women at heart, I thought I would call in to put in some input on this very important subject.
Please go ahead.
That you're on tonight. It is very unfortunate that something that is easily prevented if the woman does her pap smear once or twice a year, and it is
even once a year.
Indeed. It is so unfortunate that so many... By the way, do you have the current statistics as to how many of our females died from this condition yearly?
It's about 26 per 100,000.
Okay, how many females die from it?
Indeed.
Well, I could. Well, I have
and how many are affected?
Well, I have the information in front of me, and it goes. The data I have goes back to 2011.
Yes.
And in terms of cancer of the cervix, for the total for female for 2011, where there was 191, and for 2010. It was 158. For 2008, it was 142. It basically has not moved very, very much over the years. So it basically remains a constant. So despite the fact that we have active health promotion drives and women are aware of the risk And these are women who die, by the way. So perhaps Dr. Dr. Clark would like to comment on how many do have it. What's the statistics?
Well, if you look at those who die, because usually you talk about in terms of 100,000 women, and it's about 26 per 100,000. And if you compare it with first world countries, they are less than 5 per 100,000. And this is 50 years ago, we were all at the same level.
Yeah.
Right? And the thing that has brought it down, because these are the same women, so the thing that has brought it down is that the uptake of pap smears is much, much more in those countries.
Yes.
Right? And it's not even first world countries. If you look at our neighbors, right? So for example, Cuba has a much lower rate of cervical cancer than we do.
Yes.
Right. So we can't even distinguish between first world and third world, because other third world nations have a much lower rate.
Yes. You mentioned, Doc, that a woman who have been with more than one sex partner
is at risk, and it's recommended that you have one faithful partner for the rest of your life, really. A committed, faithful partner.
Yes. But what about a woman who is with a man who have or had several sex partners?
Same thing.
The past?
Excellent question. Excellent question. You want to respond to that, Patrick?
Right. It's the same thing. If your partner has several partners, and your partner is not using a condom, right? Indirectly, you have several partners.
Yes. I did what you could describe as an unscientific survey to get some insight from some of our female as to why more of them are not doing their pap smear. And I was rather surprised that even in today's day and age, some women still believe that this is a painful or discomforting.
Uncomfortable. Yes, Carly, you're perfectly right. In fact, I'm a family physician, and Dr. Clark is a consultant obstetrician and gynecologist. But when we do most of the pap smears, and when they get into trouble, they send them to Dr. Clark. But seriously, I've had many women who come to me to do pap smears, and they're literally shaken with fear. And they're told this misinformation. That the pap smears are a very painful experience. And it is not.
By other women.
By other women,
exactly.
It is
Some
not.
of whom have never done one before. You know, I had a
before you go on to the Dr. Clark, just just walk this gentleman through as to what is involved in a pap smear to allay this fear.
Indeed.
All right. Well, a pap smear we do on women who are sexually active. Right? There are some authorities that actually, when they give the criteria about who would do a pap smear, some people actually say by age 21, regardless of whether you're sexually active or not. But that I don't think many doctors would actually do a pap smear on a woman whose hymen is intact. So usually it is something that is done on women who are sexually active. It's a very short procedure. The most uncomfortable part of the procedure is putting in what we call the speculum, which is a usually metal, can be sometimes plastic instrument that we use to open up the vagina so we can see the neck of the womb, the cervix, clearly. Then we use a soft brush.
Patrick, before you go on to the brush, I just want you to emphasize that speculum comes in many different sizes. And so there are some very small speculum for women who have never had any children, and so oftentimes the women's fear is that the doctor will use a very large speculum on them. And the doctor...
So usually you go to any doctor's office, he has speculums in several different sizes.
There you are.
So for example, a woman who has 6 children is probably not going to be... you're not going to use the same speculum as you'd use as a woman who has no children. Right? So they come in all different sizes. You have from very small to the very large. Because they're so tense, and they're just waiting to experience this great pain.
So So caller, we're going to have to take a break shortly. Are there any other burning questions you'd like to ask?
Okay, finally, what is your take on this vaccine that they say can give to, that should be given to teenagers to prevent cervical?
Very good idea, because 95%, if not more, of cervical cancers related to the HPV virus.
Yes.
Right. So,
which means human papilloma
virus, which is a sexually transmitted virus.
Yes.
And so the vaccine is an attempt to minimize the effects of that virus. So once you can minimize the effects, you are going to decrease your rate of cervical cancer. So it is given to pre-pubertal girls, young girls, before they become sexually active. So that even if they acquire the virus later on, because they have gotten the vaccine, the effects of the virus, the deleterious, the bad effects of the virus will be minimized.
Until that is the case, do you believe that if perhaps the messages drive home to these women as to the graphic nature of this condition and what it does to you, while it is in the stage of taking your life, do you believe that might force?
You mean somewhat similar to the cigarette thing on the cigarette box?
Yes.
That may be a bit too...
That's a tough one.
Died from it, and believe me, she went through hell.
It usually can be a very painful way to die. So,
indeed,
I must tell you the truth. The idea of displaying medical pathology in public space might be a little hard for some people to cope with, because the visual imagery of a woman who's dying, it can be quite painful.
But what is the youngest age female you ever saw with cervical cancer?
Cervical cancer?
Yes.
I think
I've seen a young lady die from it, and she was only 32.
No, I've seen younger than that. I've seen 25 recently.
What the devil is saying?
25, yeah. We're going to a break now?
No, not yet.
Okay. We go back to the HPV virus.
Yes.
All right? The HPV virus, like most viruses, is going to be attracted to rapidly dividing cells. All right?
Yeah.
When you look at the girl whose body is just developing, the prepubertal girl, right? Her cells, right, in the genital tract are rapidly dividing. Now, when you take a girl who starts her sexual intercourse at age 13, right?
Yes.
10 years later, if she has gotten the HPV virus
at 13,
okay,
10
years later, she has gone through all the stages. So she has gone through the pre-cancerous stage. She has gone into the early cancerous stage, and by the time she's 25, she presents with late cancer. And when I say late cancer, you don't need your pap smear to see it. You can put in your speculum and you can eyeball it with your naked eye. Right? All because she got HPV virus at age 13, and it has done its damage over 10 to 12 years.
Okay, thank you very much, Dr. Clark. Caller, I really appreciate you calling tonight, and thanks for sharing with us. We're going to take a short break. We'll be right back.
Hello?
Hey, girl, where you there?
I'm in the studio.
Hey, girl, where you do a studio? Come on, now.
Who you call, girl?
I said, come on, now.
You know overtreat a girl. You know overtreat a girl.
Right. You're listening to IRFM, and this is your late night show. It's called Sex Wise. I'm your host, Dr. Alveston Bailey, and tonight is Call-In Clinic, and we have a doctor in the house, Dr. Patrick Clark, consultant obstetrician and gynecologist from St. Anne's-Bay. He's here to discuss any issues you might have with respect to your own femininity. We just had a interesting discussion with the caller looking at cervical cancer, and he bemoaned the fact that this particular highly preventable illness is so common in Jamaica, which really is a shame, and we really need to actively sensitize our person or females about this particular fact and encourage them to really do the pap smear and reduce the number of partners that they have, and of course refrain from first sexual activity until about 20. You did mention 20, Dr. Clark. I found that interesting. The age of consent is 16. Perhaps you need to speak with our lawmakers for them to roll the age of consent back up to 20 or 21.
Well, the age of consent is not based on anything scientific.
Obviously not.
Whereas the statistics, the studies show that before 20, your risk increases.
Right. So therefore, if you have unprotected sex, say in your teen years, you are at a greater risk of developing cervical cancer. Right. You're listening to IRFM, and we want you to join us in this discussion. Feel free to call us and share your thoughts with us. The numbers are 974-5051, 5079-5043, 618-0352, and 1-888-991-4152. Caller, welcome to IRFM.
Greetings.
Good. We're getting a lot of men tonight, Patrick. Good night to you, sir.
The woman name will call. Sometimes it's good to listen. So perhaps she's listening, you know?
No problem. Talk to me.
Thanks for everything. A few Sex Wise ago, a few programs ago, when we spoke about the way the system, church and state, that is, has placed a taboo on sex and, you know, removed the way sex has been esteemed from creation, and because of that, most of the youth, especially, has been turned into sexual zombies. We were told that according to data and statistics, it is not too bad. I think it's the same doctor who is in Australia said that. It's not too bad. But, you know, he wouldn't like to know what is happening.
What is not too bad?
He was saying it is not as bad as I was saying, you know. And, you know, but while he was saying that, I was saying to myself, he wouldn't like to know the unimaginable thing that is happening in the sex world as he was speaking, you know. Age, refraining from sex until one is 20. And having one sexual partner. Those two things.
Okay, caller. What advice? We do recognize that unsafe sex is risky. What advice would you like to give a female?
Please. Let me follow my line of reasoning. No, please allow me.
Well, you do have.
Do you want me to hang up? Do you want me to hang up?
No, man. We appreciate your call, but I just thought you're going to give us some advice.
We will come to that. We are saying that very few that the case of sex beginning to have sex 20 or over. That is rare, you know. And in terms of having one sexual partner, that is also rare.
Okay. Because
of the same situation with the sex situation that is happening. So, what is needed, you know, what is really needed?
Okay, tell us.
We are tackling this thing from too much branches and stems and things. We must tackle this thing from the root. The root of the matter is that the church and state has placed the cat before the horse and has put sex in a position that has turned the people into sexual zombies.
I know you said that before, caller, but
yes.
but from what I gather, hold on, caller, hold on. From what I gather, from the church actually actively promotes celibacy and healthy sexual lifestyles and marriage and so on. So you're accusing the church
marriage
of
and so on. You strike it right there. The church has said that marriage before sex.
You mean sex before marriage?
No, the church has said marriage before sex.
Right. Do you have a problem with that?
And what we are saying, and I've always said, and we know that it is so, that sex is marriage.
Okay.
Sex within itself is marriage. When a man, and that must come forward to that original way of life.
All right.
When a man and a woman lay down and have sex, they are getting married, and every time they have sex, they are renewing that marriage vow.
Yeah, but you're blaming the state for being responsible. I mean, the state and the church for being responsible for the promiscuity in the society, isn't that
so?
But
of course, the church and the state together has conspired and in complete with something they call marriage.
Okay,
and we know what is termed as marriage. This a ring and this I do, and sex is nowhere inside there.
Okay, caller, hold on, caller.
Yes.
I think we really appreciate your point that you don't agree with the church's position with respect to marriage, and you understand. Well, I really want to thank you, therefore, for making that point, and of course, you can call us again another time. All right? Thanks for calling. Interesting discussion the gentleman had. And he calls us fairly often. He's one of our favorite callers, and we appreciate his contribution. Now, Patrick, I want to move on to another topic.
Just to clarify a point, that in all the scientific studies,
yes, right,
they say having a single partner is best.
Right.
Right? None of the studies speak to whether you're married or not.
All right. And
right. So there's no politics in play either involving the church or the state.
You know, when we look at the data,
we are talking about a single partner.
Totally agree.
So if you want to have a formal marriage, or whether you want to have a common law marriage, the key point is a single partner.
Excellent. I thought a problem that a lot of women are grappling with, which seems to be a problem that just keep recurring almost on a daily basis in most practices, is the presence of fibroids. What are those?
Fibroids are what Jamaicans term as growth in the womb. Right? So they are a non-cancerous swelling that grows in the womb. Very, very common in black women. Right?
Why is that so?
It's said that nobody really knows. Speculation, whenever you don't know what the cause of something is, there are always many, many theories. This is no different with fibroids. Obviously, there's a genetic link, because it's very common in black women wherever they are in the world. There are some people who will tell you that it is linked to diet.
Yeah, that comes up often.
Right.
In fact,
but that's very unlikely, because whether you have a Western diet, whether you have an African diet, whether you have a Caribbean diet, it is extremely common once you're a black woman.
There you are.
Whether you're a vegetarian or whether you're a meat eater, it is still common.
But thanks for clarifying that, because one of the arguments that a lot of persons put forward is that the type of food that we eat, especially meat and chicken, that has been grown with hormones, they seem to think that somehow promotes the growth of fibroids. Is that so?
No, I mean, the addition of hormones to chicken, I think, is a fairly recent thing, isn't it?
Yeah, that's true.
And you've had fibroids from many, many years ago. 50 years ago, you had fibroids. I don't think they were adding hormones.
Yeah, but you're saying the prevalence of fibroids in a woman with the modernization of the food kind is not a factor that we need to worry about.
No, I don't think it has changed at all. It may be apparently more prevalent now, because many more women have access to health care, many more women have access to ultrasounds, but certainly it has not increased with any change in diet.
Dr. Clark, when I was in training a few years before you, that speaks of my age, of course. But seriously, we had a little jingle in medical school which said that good girls get fibroids and bad girls get babies. Is there any truth to that?
Good girls get fibroids.
And bad girls get babies. The argument was that if you start having children early, you might reduce the prevalence of fibroids.
No, not really. The only link between that is that if you have a lot of fibroids, there may be some fibroids do cause infertility. Right? So if you have fibroids, then you may be less likely to have children. But really, in actual fact, fibroids are extremely common, but being unable to get pregnant because of fibroids is uncommon. So most women who have fibroids can get pregnant. And so if a woman presents trying to get pregnant and has obvious fibroids, we are not going to say it is the fibroids that are the cause until we rule out everything else completely.
You're listening to IRFM, and this is a late night show. It's called Sex Wise. I'm your host, Dr. Al Bailey, and we have a doctor in the house, Dr. Patrick Clark, consultant obstetrician and gynecologist. And tonight is call-in clinic where you can call and ask us any questions having to do with femininity. The numbers are 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. We have a doctor in house, and feel free to call us. With respect to fibroids, how does it present?
The majority of women who have fibroids don't have any problems whatsoever. So it is often discovered incidentally when they go for a checkup, when they do an ultrasound for any cause whatsoever, and they don't know they have it. In those who do have symptoms, then the main things are, one, that they may feel a lump in their tummy, right? If the fibroids grow to a significant size. Once the fibroids grow to, when we talk about the size of fibroids, we use how it would compare to a pregnancy. So a woman who has fibroids the size of a 3-month pregnancy may feel them.
Oh, it goes to that size?
It can go to much bigger than that.
Oh, what's the largest size you've ever seen?
The size of a 9-month pregnancy.
Oh, that takes you all the way underneath
she's pregnant.
Underneath the epigastrium, right below the rib cage.
You look like you're about to deliver.
My goodness.
So they can get very, very large.
Okay, we have a call online. Caller, welcome to Sex Wise.
Good night, gentlemen.
Good night to you, sir.
Long time I didn't hear from you, Dr. Bailey. It's fire. I just think to give you a hail up, you know.
Well, it's great to hear from you. So who is this?
Just fire.
Fire. Okay. So what do you have to share with me tonight?
Well, just feel sick of your culture. Still living or still around.
My goodness, you're very kind. So thanks very much for calling.
Okay.
Thanks very much. You're listening to IRFM, and this, of course, is your late night show. It's called Sex Wise. I'm your host, Dr. Al Bailey, and we have a doctor in house, Dr. Patrick Clark, consultant obstetrician and gynecologist, who's here to field any of your questions. You can call us at 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. Now, Dr. Clark, you were mentioning that fibroids can grow to these massive sizes. Right? Why would a woman allow fibroid to be the size of a 9 months pregnancy? That must be difficult.
Well, it depends on what symptoms they're having.
Okay.
So the woman who doesn't really have any symptoms at all may just think she's putting on weight.
And in many instances, you're suggesting that some women have fibroids and don't even know.
And don't know, no. Because more than half of the women who have fibroids do not have symptoms at all.
Okay, so what sort of symptoms would they normally present with?
Right, so to those who do have symptoms, the most common things are, the most common one is heavy bleeding. Right, so they say that the periods are usually regular, because it doesn't really change up the cycle of the period. It just makes it heavier. So instead of having your cycle for 3 to 7 days, they may complain that when the period comes, it lasts for 10 days. It is associated with clots, and they have to use pads in excess of 30 pads, and sometimes the pads are not enough. They have to use towels and even sheets and that kind of thing.
Oh, that would be quite uncomfortable. We have a call online. Caller, welcome to Sex Wise.
Hello, good night, Dr. Daly.
Good night to you. It's great to have a lady on line at last. Welcome.
I have this one question. I'm calling from Falmouth.
Yes.
I am obese, you can say that. I have been having heavy periods, right?
For how long now?
And it's associated with a lot of blood.
How old are you?
I am 29.
Okay, and you have heavy periods with clots. Mm-hmm.
Yes.
Mm-hmm.
Could this be a sign that I have fibroids?
Well, so Dr. Clark, she has basically abnormal uterine bleeding, and should like you to discuss.
Are your periods regular?
No, not all the time. Sometimes I may see it for like 1, 2, 3 months. On the 4th month, 5th month, nothing. Then it comes and it's associated with a lot of cramps.
So you miss your period sometime?
I'm sorry?
You miss your period sometime?
I do have periods sometimes.
No, do you miss your period sometime?
Oh, yes, I do.
What's the longest that you have missed?
What's the longest that I've missed it? 2, 3 months.
2 to 3 months, okay.
But for a while now, I just miss it like 1 month, and then it comes the next month.
And when it comes, it's heavy.
And it is very heavy. And a lot of cramps.
Yeah, that could be fibroids, right? But then again, it could also mean that you have a hormonal problem.
I do have a hormonal problem. I was told by a doctor.
Right, because if you're obese and you miss your period sometimes, it's very likely that you have a condition called polycystic ovarian syndrome. In this condition, you tend to miss your period, and while you have missed your period, your body is producing estrogen, one of your female hormones, and it's building up the lining, right? So when you miss a month, the lining gets even thicker, and then you reach a point now where the lining is now so thick that the body can no longer support it, and then you start to bleed. And so because you have missed a month already, or you have missed 2 months, and the lining is extremely thick, you have more to lose, and you tend to have heavy periods.
What's in the case? For the past month, like 3-4 months, it's coming like clockwork, right? And I haven't missed any of them, but it's still heavy.
Still heavy, so more than that. So also it could be due to fibroids. So have you done an ultrasound yet?
Not yet.
I see. You need to do an ultrasound. How many pads do you use for the whole period?
Okay, I've never really counted it like that. I know I use the pack of 14 always, and sometimes I have to be using like a pack and a half for the day.
Pack and a half for the day?
No, a pack and a half. The overnight, I use that during the day, so like when I'm up and about, and in the night I use the medium flow. Right. So for my whole cycle, I may use like 2 packs, 2.5 packs.
Which is more than 28 pads.
Yes.
Right, that's obviously very heavy. Although women, there's great variability in how often women change the pads. So some people change it when it's very lightly soaked. But certainly if you're using more than 20 pads per period, it suggests that the periods are indeed very heavy. Right, so you would need to do an ultrasound.
Okay, I'm sorry. I'll be standing or walking or even in a cab or anything like that, and then I just have this question. It's very uncomfortable, and you can never tell. I can never tell when it's going to mess me up or anything. I always have that phobia of it happening.
So you have to stay at home sometimes when you have your period.
Okay. I try to.
Okay, Dr. Clark, if she, let's presume that she does an ultrasound and it indicates that she does not have a fibroid, what are the treatment options?
Right, if she does not, if there's no fibroid and you're having heavy periods, then usually our first line treatment is the family planning pill. for somebody who's not trying to get pregnant, right? Because the family planning pill will actually make your periods much lighter.
But I was told by my doctor that I can't take family planning because the pill is because I can't take hormones, right? Because I have this hormone problem.
That's not true.
Okay, so you're recommending family planning pill. In an emergency, how do you deal with that? I mean, she comes in bleeding really heavily.
If you're bleeding heavily to the point where you're dizzy and you can't walk, then she would need to be admitted, and if she's not a Jehovah's Witness, she would need to get blood. We don't normally do surgery under those circumstances. In an emergency, we usually wait until the patient is stable before we would consider surgery. But since most women who have fibroids don't have symptoms, and many of them have mild symptoms, somebody who requires surgery would be one, her blood count has fallen, right? So if your blood count falls, it means that your bleeding is very excessive. If you are bleeding to the point whereby when you have your periods, it curtails your activities, you can't go to work, you can't go to school, then somebody who fits into that group obviously would need surgery for their fibroids.
Are there, apart from the hormones that you mentioned, are there another medication that can be used to regularize the period and suppress the volume of bleeding?
Well, there are some that not necessarily regularize, but to decrease the period. So there's a group of drugs called the NSAIDs. Most Jamaicans will be aware of those.
That means non-steroidal anti-inflammatory.
Right, Brufen, Advil will fall into this group. These drugs will decrease the period by 30%, it is said. Right? So if you are having torrential bleeding, 30% is not going to be that much, really. But generally speaking, between the NSAIDs and the family planning pill, those would be the first line. There are other methods that you can use. For example, the family planning pill can also be used to reduce the amount of bleeding. The family planning injection can be used to reduce the amount of bleeding. That might give you a spotting, but at least it will take away the torrential bleeding. Right, so there are some methods. There are some medications that can be used, but by and large, if you are having extremely heavy bleeding with fibroids, those methods are really just temporizing methods. You probably will need to have surgery at some point.
Okay, so question for I don't have any other. I have the heavy bleeding, but it lasts for like 5, 6, 7 days, and then it gets a little lighter, right? So it's not like how you're talking. But if because my stomach keeps, getting a little bigger, and I don't eat a lot. My eating habits are not proper, but I don't consume a whole lot of food. But it keeps getting, and it makes me uncomfortable. So I'm wondering if it's the case that I may have it.
Well, first thing to do is go to your doctor so he can write up send you for an ultrasound.
Yes, caller, that seemed to be the easier solution to your problem, since you're overly concerned about the size of your abdomen.
And if it's not fibroids and it's hormonal problem causing it, really, I never heard of saying to a patient, oh, you have a hormonal problem and therefore you can't take hormonal tablets. Women who we would not give the family planning pill are those over 35 who smoke, those who have either a personal history or a family history of blood clot. If you have undiagnosed bleeding, and it could be a cancer that has not been discovered yet. So those are the groups of women who we would say cannot take.
Okay, sorry, I may have misled you. Let me clear this up a little. It's not that my doctor said that I can't take it because I have hormone problems. It's just that whenever it's given, Premarin, the family planning, whatever, Progalutin and all of those, I always have a problem. It's either the the bleeding may subside a little and then it comes back. Like I'm off of it for like a day or two. It comes back.
You mean if you stop taking the tablets?
No, I may take the tablets that is prescribed, and then it comes back. Or
when you say it comes back,
it
what do you
doesn't
mean?
stop.
You mean the bleeding returns, or after a while the problem returns? Which one?
Yes. I may take, like, say, suppose that I'm supposed to take the tablet for 28 days, right? And after the 28 days, 29, 30th day, it's back again.
Yes, I think the problem there is that you're not taking the medication long enough. Even for the woman who does not have any hormonal problem, who starts on family planning, one of the most common side effects is that she's going to have irregular bleeding. And we say to patients, okay, when you start this medication, you may have a little bit of haphazard bleeding. Usually by the time you have reached the second or the third month, the bleeding will settle down and you will have regular periods. And that's for the woman who does not have a hormonal problem. For the woman who has a hormonal problem, you can't take it for 1 month and stop. There's no point in that. There's no point in that. So if for example, you have PCOS,
that's polycystic ovarian syndrome.
Hormonal problem, and you are being put on the family planning pill. The minimum time that you would be on it is 6 months. Yeah. So taking it for 1 month, and so when you start that pill, and it solves the problem, it's not because we have cured you, right? So if let me give you an analogy. If you have diabetes,
I do.
And, well, I'm just using an analogy for the time being, and you are on insulin for 10 years. While you're on the insulin, is your blood sugar controlled?
Yes.
Right. Is the condition cured?
No.
So when you stop the insulin, what happens?
It's going to go out of whack.
Exactly, right? So the hormonal problem is something that you have. It's inherent in your system. So you go on the family planning pill, and you have regular periods while you're on the family planning pill. It's not because we have cured anything. You are having regular periods because you're on the pill. When you come
so
off
in
the
other
pill,
words, I'd have to stay on that.
Hold on. When you come off the pill, you revert back to your natural body status. So yes, if you want regular periods, you're gonna have to stay on the medication, and you stop the medication when you're ready to get pregnant.
Okay, caller. We have given you a fairly good length of time to discuss your problem. I hope we have been of some help to you.
Yes, Dr. Bailey.
And of course, feel free to call us again on IRFM.
Convincing, does she?
but you do get the message that if you're taking hormone tablets for abnormal bleeding, you have to stay on it for a little while in order to get you back on even.
How old are you, by the way?
I'm 29.
Do you exercise?
I try to, as much as I can.
That sounds like a no.
Dr. Bailey?
Yes, ma'am.
I know you're going to beat me for this, but I'll see you in your office tomorrow.
My goodness. Apparently.
And I'm sure you know who it is.
I suspect that I know who's calling. Thank you very much for calling.
Okay,
all right, have yourself a good night.
You too.
You're listening to IRFM, and this is our late night show called Sex Wise. And of course, I'm your host, Dr. Al Bailey. And it's call-in clinic, and we have a doctor in the house, Dr. Patrick Clark, consultant obstetrician and gynecologist. And you can call us at 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. We have another call online. Caller, welcome to Sex Wise.
Good night, Doc.
Good night to you, caller.
Yeah, I'm having this problem.
Tell us about it.
Yes. I'm having this terrible scratching.
You're having terrible itching?
Yes.
We're hearing a little noise in the background. I'm not too sure what's making that noise. Okay. You're having terrible itching?
Yes.
Where?
It gives me that, makes me very uncomfortable.
You're having terrible itching where, my dear?
Pardon?
Where are you having the itching?
just on the vagina.
Or in your genital area. And it makes you uncomfortable.
Yeah.
And you'd like us to discuss with us the causes of vagina itching and the treatment. Is that what you want us to do? Okay, Dr.
Well, have you been on any medication?
Yes, I will listen because I only have like 1 minute. Yes.
No problem. Thanks for calling, huh? Yeah, her problem is that she has
itching.
Severe itching in her genital area.
Right. The most common cause of itching in the vagina, and it's extremely common, is yeast infection. And usually the women describe that they have a white discharge. It can be yellow, and it's thick. Some women will actually describe it as being like wet cotton wool. So it's extremely common. It tends to be recurrent because the yeast actually lives in the vagina. But it's fairly easy to treat. And when we say treat, we mean that particular episode. Now, because the yeast lives in the vagina, it's not something that we can cure, right? So there's no medication.
But that's an interesting point, right, because a lot of women,
medication that we can give to you and say, take this and it will never come back. Okay, that's not going to happen.
In fact, a lot of women actually do come to see the doctor, and they're very disappointed when about 3 months later the problem returns. And they say, but doc, I thought you could have cured me. You're trying to clarify that point. It can't be cured.
It can't be cured.
Okay.
Right, so I tell women, once you have a vagina, you're going to get yeast infection at some point.
That's so disappointing.
It is. But it's a normal part of the organisms in the vagina.
Okay.
So when the woman has symptoms or when she sees a discharge, it's because it has overgrown.
What could cause that?
There are some risk factors for yeast infection. So women who are obese, women who are on the family planning pill, women who are diabetic, those women who have a very high sugar diet, women who wear a lot of tight clothing, women who wear so-called occlusive underwear, so women that nylon, spandex, that kind of thing, in contrast to cotton. All of those are regarded as risk factors. Of course, if you're diabetic or if you have HIV infection. So those are the known risk factors. The primary risk factor.
Are there medications that can trigger it off?
There are some medications, antibiotics. So women will complain that sometimes if they get antibiotics for any reason at all, they get a yeast infection afterwards. Right. So antibiotics are used, will give you a yeast infection. They're not used to treat a yeast infection, because there are many women who will go and try to get antibiotics when they have a yeast infection, and that's going to make the yeast infection worse.
And a question that a lot of women sometimes ask: if they have a yeast infection, can their partners also develop inflammation of the head of the penis?
Right. So generally speaking, yeast infection is not sexually transmitted.
Okay.
So yeast is very, very common in women, but very few men get yeast infection. So generally speaking, I tell them that the only time the partner needs treatment is if the partner himself has symptoms. There are some women who will insist that he is treated because they think that he is reinfecting them, and so for peace of mind for the person, you might give them the medication. If the man, however, has yeast in the penis, the head of the penis, we also have to make sure that the man is not diabetic, because that is how diabetes often manifests itself in men.
That's very true. In fact, in many instances, when a man presents to you with irritation of the head of the penis, and you get this sort of whitish discharge on the head of the penis, which itches a lot, inevitably, when you check him, he has diabetes.
He has diabetes.
Now, is it easy to treat? Not cure, treat.
It's easy to treat, yes. Some women might not think so because they're treated and it comes back, right? But yes, it is fairly easy to treat, and there are many different preparations. It's something that is very common, so a lot of companies have put in the time and effort to make a lot of drugs. So there are many drugs that can be used to treat it, and these drugs can either be taken by mouth, or they can be inserted into the vagina, or for those women who have itching on the outside, you can use it on the outside. Creams for the outside of the vagina as well.
Now, that was the voice of Dr. Patrick Clark, consultant obstetrician and gynecologist. We're going to take a short break. We'll be right back. All right, welcome back. You're listening to IRFM, and this is your late night show, Sex Wise. I'm your host, Dr. Alverston Bailey, and we have a doctor in the house, Dr. Patrick Clark, consultant obstetrician and gynecologist, who's here to field all your concerns having to do with obstetrics and gynecology. Feel free to call us on the following lines: 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. Dr. Clark, before we took the break, you were discussing vaginal itching, and you mentioned that there are some risk factors like diabetes, taking antibiotics, wearing tight clothing, using spandex and nylons and so on, and high sugar diet. Therefore, I suspect what you were saying is that in many instances, if you can identify a trigger factor or root cause, you can avoid it. What advice do you want to give?
Theoretically speaking.
What advice would you like to give a woman?
Yeah, those are, as a theoretically speaking, because there are many women, in fact, I think most women who get recurrent yeast infection don't have any of those factors.
There you are.
Right, so yes, those are stated trigger factors, right? But sometimes it's very difficult.
The reason why I ask is because many women come to me and say, can you put me on a special diet in order to prevent yeast infection? But before you respond to that, we have another call online. Caller, welcome to Sex Wise. Good night, caller.
Good night.
Good night to you. Welcome to Sex Wise. What's on your mind?
Yes, the same yeast infection.
Okay. What's on your mind?
Like every month, it's been coming on to me.
Okay. Have you done your sugar test?
Yes.
So
every month I've been to the doctor.
Not diabetic, HIV negative.
No, I'm not diabetic.
And HIV negative?
No.
Is it yes or no? No, you're not.
No,
okay.
I'm not.
All right, no problem. What she's asking, Dr. Clark, is for women who get recurrent yeast infection, is there anything that a doctor can do
to prevent it? Can't cure it. The aim really is to try to decrease the frequency. Right? So sometimes it requires, for example, continuous treatment for 3 to 4 months. So you give them a repeat prescription and you say to them, take it now, and then a month's time you take it again, and then a month after that you take it again, and then a month again you take it again, whether or not you have the symptoms. Because since we know we can't cure it, we try to minimize the frequency with which it occurs by trying to decrease the number of organisms that you have in the vagina. So we give you the prolonged treatment, hoping that after 3 to 4 months straight treatment, it will come less frequently.
It started to happen after I have my son. My son is 9 years old.
That's probably just coincidence. That doesn't really have anything to do with it.
But I take like the mini-gyner.
Well, mini-gyner is one of the risk factors. The family planning pill is one of the risk factors. People who are on the pill tend to have more yeast infections.
Okay.
So in that particular case, if it becomes problematic,
sometimes the benefits of the family planning pill
far outweigh
the disadvantages such as yeast infection. So you wouldn't really stop the pill because of yeast infection.
I wanted you to emphasize it because you don't want you now to stop your mini-gyner and get pregnant because of your yeast infection.
But what you can try to do though is to move to a lower dose pill. Like the mini-gyner is one of the older pills that has the higher estrogen content. That's the hormone in it that causes the yeast infection. So you can try one of the newer pills that have a lower dose of hormones.
Okay.
All right.
No, thank you.
Okay.
Thank you very much, caller. Thanks for calling. You're listening to IRFM, and of course, this is Sex Wise. I'm your host, Dr. Al Bailey, and we have a doctor in the house, Dr. Patrick Clark, consultant, obstetrician, and gynecologist. You can call us and share your thoughts with us about anything having to do with female obstetrics or gynecologic problem. And of course, the numbers are 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. Please call us and share your thoughts with us. This issue of yeast infection must be quite a problem in your practice, isn't it?
It is, right. The vaginal infections, I think, probably will, for any gynecologist, will comprise a significant portion of the patients who come.
In that particular case, then, let us move on. Apart from yeast infection, what are the other causes of vaginal discharges?
Well, just to go back to yeast infection, there are some suggested home remedies. Whether they work or not is another point. But there are suggested home remedies.
Give us some advice.
For example, one of them, and this is actually on the internet, it's not a Jamaican thing neither.
Yes.
One of them is the use of garlic.
Yes.
Right? So apparently you crush the garlic and you insert it into the vagina. Right?
Careful now. We don't want all the ladies to start using garlic.
I don't know if these work or not, but they're in the papers.
Okay, it's a suggestion.
When you look in the forums, a lot of women swear by them. And another one is the use of yogurt. Right?
Okay.
This one I found particularly amusing because I had a patient one day who said that she eats a lot of yogurt. So I asked her, what kind of yogurt? And she says, well, she just goes to the store and she buys the nice flavored yogurt.
Yes.
And eats it. Right?
And that prevents her from getting this?
I went to do my research. Right? And yes, there are articles on the internet that suggest that yogurt can be used, but this is the so-called natural living yogurt, or they call it the probiotic yogurt.
Okay, Dr. Clark, we're going to get back to some natural treatment for yeast infection, but we have a caller online. Caller, welcome to Sex Wise.
Hello, good night.
Good night to you, caller.
I would like to know if yeast infection automatically goes away by itself without taking antibiotics.
My goodness. Go ahead.
No and no.
No.
No and no. Yeast infection is not treated by antibiotics. So if you don't have a yeast infection and you take antibiotics, you're likely to get a yeast infection.
Okay. So
right?
what? So if we don't take...
All the point, caller. Let Dr. Clark
finish. So that one, did that one sink in? If you don't have an infection and if you don't have a yeast infection and you take antibiotics, so for example, you have a sore throat, or you have a bladder infection, and you take antibiotics, then you're likely to get yeast infection because antibiotics in some women cause yeast infection.
Okay,
right?
so yeast infection does not...
If you have a yeast infection and you take antibiotics, it's going to make the yeast infection worse because antibiotics are not used to treat yeast infection. You have special antifungal medication, which is not an antibiotic, that is used to treat clumpy, thick discharge, right? And it can occur in women who are or women who are not sexually active. So a woman who has never had sex in her life can have a yeast infection because it's not a sexually transmitted disease. Herpes now, it does not come with a discharge. Herpes is a sexually transmitted disease caused by a virus, and the vast majority of people, both men and women who have herpes, will never ever have any symptoms. All right, so more than 75% of women and men who have herpes, you don't know that they have herpes. For those people who have herpes, who have symptoms, then it usually comes out as water bumps anywhere that the virus enters the body. This is usually in the genital area. So, for example, on the woman, she said she will normally tell that she feels some burning, and then when she looks in the vagina, she sees water bumps, or if those water bumps have burst, she sees shallow ulcers, little sores on the outside of the vagina. Right? And those will, if you don't treat it, it will go away by itself, it will heal up by itself, but then it will often come back at a later point.
Okay, caller.
All right.
Does that answer your question?
So the only similarity between herpes and yeast is that basically they're both recurrent. For those people who have symptoms, they're recurrent problems. Right? So if you have yeast, it's going to be recurrent. If you have herpes and you have symptoms from the herpes, then you can expect it to come back over and over again.
You made a very important point, Dr. Clark, which is that many persons with herpes
never have any symptoms.
Do not have any symptoms. And also another very important point, that whereas on the male genitalia, the herpetic lesions, which are little group vesicles on the genital, can be seen. If a woman has herpes on her cervix, then that's a different story.
See it, right?
You won't see it. And so you can have herpes on the vagina, inside on the vaginal cavity or on the cervix, and you just can't see it. Or you could have herpes which does not have any symptoms at all. Okay, you're listening to IRFM, and this is, of course, your late night show. It's called Sex Wise. I'm your host, Dr. Al Bailey. And tonight we have a doctor in the house, Dr. Patrick Clark, consultant, obstetrician and gynecologist, who's here to share any concerns that you might have. You can call us at 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. This is IRFM. We have a call online. Caller, welcome to Sex Wise.
Hello.
Good night to you, caller. Please go ahead.
Good night, sir. I would like to find out if you have the fibroids and you have this infection.
If you have the fibroids, what?
Yeah.
And you... Go ahead. Please repeat the question, caller.
Yeah, if you have the fibroids, if that can give a yeast infection.
Oh, okay. She wants to know if fibroids causes yeast infection.
No, those are two separate things completely. There's no relationship between fibroids and yeast infection.
Okay.
Right, so fibroids, if you do have problems with the fibroids, it will give you heavy periods, painful periods, a lump in the tummy, problems getting pregnant sometime, but it does not cause yeast infection, no.
Okay, thank you. Could I get the number for the doctor, please?
377-0122. That's for me, and for Dr. Clark, it's 974-3029.
974.
I got the wrong number there. 974-3079.
79.
Oh, okay. 974-3079.
3079.
Yes. All right then.
Pardon? What is the number? 974?
3079.
Thank you.
Thanks for calling. Okay, Dr. Clark, could we move on then to some of the other causes of vaginal discharges?
In addition to yeast, the other non-sexually transmitted disease that is very common is bacterial vaginosis. Like yeast, this one lives in the vagina. It's a normal part of the vagina of many women. And so it tends to be recurrent. So just like the yeast, you get the bacterial vaginosis symptoms when it overgrows. When it's treated, it goes back to normal levels, but we can't eradicate it. So they often occur together. They're very good friends, right? So many women have the bacterial vaginosis and the yeast infection at the same time.
And this is caused by a bacterial.
Right, it's caused by a bacteria.
You know, it's important to emphasize that point, because many times you do a pap smear and it comes back with BV. And I have known women who actually freak out, you know, because BV is found. They said this must be a STD.
Right.
How do you respond to that?
No, I tell them that when you explain to them that it's like yeast, it occurs in the vagina under normal circumstances. It's not an STD. It lives in the vagina as part of the normal vaginal organisms. Then they usually will understand, especially that your partner doesn't need to be treated. Right? So I usually inform them as well that treating your partner will not make a difference to how often you get it, because it is not an STD.
Are there any reasons why women get it often?
Unlike yeast infection, where there are a lot of risk factors or associated factors, that's really not the case with bacterial vaginosis. So it is really unknown what the trigger factors are. As probably the best trigger factor you can get for both yeast and bacterial vaginosis is that it tends to occur most commonly just after the period. And that is thought to be because in the presence of blood, these organisms tend to grow, right? So when you have your period, they grow, and then after the period, it becomes manifest.
How is it treated?
You can, because it's a bacterial infection, you can treat it by antibiotics. So because it is realized that yeast and bacterial vaginosis often occur together, there are many inserts that actually have treatment for yeast and for bacterial vaginosis in the same pill, because they tend to occur together. So you can either treat them with an insert, or you can give a separate insert for the yeast and give tablets by mouth for the bacterial vaginosis.
In other words, it is easy to treat.
It is easy to treat,
but it's
going to be recurrent, right? It's easy to treat, but we can't cure it.
Right. Any other causes for discharges?
Those are the two main vaginal discharges that are not STDs. Now, when we talk about STDs, now we're talking about chlamydia and gonorrhea and trichomonas infection. Chlamydia and gonorrhea are in that group the most common, and these two are sexually transmitted diseases. Right? So you can't get chlamydia, you cannot get gonorrhea.
What causes chlamydia?
Chlamydia is an infection caused by a kind of a bacteria, just like gonorrhea, and it is passed on by sexual intercourse.
Is trichomonas a bacteria?
Trichomonas is also a bacteria. Well, it's not a bacteria, but it's somewhat like a bacteria. Is what we would call a protozoan, but it's a small bacteria, and all of those are treated by antibiotics. Now, a distinction has to be made between the bacterial infections. So when we talk about bacterial STDs, we are talking about chlamydia, gonorrhea, trichomonas, and syphilis. When we talk about viral STDs, we talk about herpes, hepatitis, HIV, human papilloma virus, that causes genital warts. And a distinction has to be made between these two groups. The bacterial infections, the chlamydia, the gonorrhea, the syphilis, once they're discovered, we can give you medication that can treat it.
Holy point from Dr. Clark. We have a caller line. Caller, welcome to Sex Wise.
Hello, good night.
Good night to you, caller.
Yes. I am wondering if you could help me. In May, I had unprotected sex like 3 days after my period. But I took the morning after to be sure. However, in last month, I was having some pains, abdominal pain, so I went to the doctor and I did an ultrasound, and they said that I have ovarian cyst. I have not seen my period since May, but the doctor is saying that probably it's the cyst that has caused it. I was worried that I was pregnant, but he's saying that I'm not. So I want to know if the cyst can cause my period to be delayed for so long.
Yes, it can.
Okay.
Mm-hmm. Did you do a pregnancy test, though?
Yes, I did 3 actually.
And it was negative, and all of them have been negative?
I didn't hear that.
All of them have been negative?
Yes, they have been negative, but it's now July and it's still not here.
Mm-hmm. And the last one was when, in May?
The last pregnancy test or the last period?
Period. Last period.
The last period was May.
Yes, a cyst can cause your period to be late. Right? You can miss your period because of a cyst. Because really, in a normal functioning ovary, every month you will form a cyst. And then at some point, that cyst will burst and release an egg. That's what's called ovulation.
Okay.
If you don't get pregnant, if that egg is not fertilized, then you have your period. All right, that's what's happening in the normal scheme of things. Now, when you form a cyst, the majority of cysts in young women are what we call functional cysts. In other words, they're formed as a result of the normal functioning of the ovary. So all that has happened is that basically you formed this cyst, you have not ovulated this particular month. All right? And because you have not ovulated, all the hormonal changes that are normally put in place to bring your period are not occurring. Right? So at some point, that cyst will burst and then your period will come back. Right? But since you can't predict that when that will happen, you can't predict when you're going to ovulate again. Since your pregnancy test is negative now, right, you need to use a condom until your period comes back. If you're not trying to get pregnant.
You know, Dr. Clark, I want you to clarify a point because she, in her opening remarks, she said that she took the morning after pill. The question I think she wanted to clarify is whether the morning after pill can cause it, interrupt her normal cycle.
Yes, the morning after pill can interrupt your normal cycle. However, it should not delay your period by more than 21 days.
Okay.
All right. So, if, for example, your period should have come the end of the month, and you took the morning after pill the first of the month, then by the end of that month, your period should come. Because it should not delay your period by more than 3 weeks.
Okay.
All right.
Okay,
so
Connor.
Please for a cyst who, well, they said the cyst is like 5 point something centimeters, almost 6.
Is it centimeter or millimeter?
I think it's centimeter.
A 5 centimeter cyst is large, you know.
Yeah, that's a large cyst, but if she's young,
yeah, I know.
Yeah, we're not usually worried about it.
Okay.
But what's the question?
Yes. So for that, you're still not sure how long the period would be delayed for.
No, and you can't. We usually say that the cyst should resolve within 3 cycles, right? So usually when you do the ultrasound, the ultrasound doctor is able to tell you, is this a functional cyst or is that cyst that we should be worried about? And if it's a functional cyst, then they would normally tell you to repeat the ultrasound in 2 to 3 months, because by that time it should have gone away.
Functional mean normal.
Functional mean that it's formed as a result of the normal function of the ovary.
Okay.
Okay.
Okay, caller.
All right, thank you.
Thanks very much for calling. You're listening to IRFM, and this, of course, is the late night show. It's called Sex Wise. I'm your host, Dr. Alverston Bailey, and we have in studio consultant, obstetrician, and gynecologist, Dr. Patrick Clark. We have another it's 10:45 roughly. We have another 15 minutes to go, so you can call us at 974-5051. 974-5079, 974-5043, 618-0352, and 1-888-991-4152. We have another call online. Caller, welcome to Sex Wise.
Good night.
Good night to you, caller.
I'm listening to your program.
Okay. Thanks for listening.
That a person has calling about yeast infection.
Yes.
If you're a person that having your regular meal.
Your regular what?
Meal.
Yes, please go ahead.
And you're sexual active. I think person should be sex often for this yeast infection not to come upon them.
Okay, so you're actually proposing, caller, that inadequate sexual activity or celibacy predisposes a woman to yeast infection. But if you are involved in regular sexual activity, that you will not get yeast infection?
Yeah, you should not have yeast infection.
Okay, I don't think that Dr. Clark will agree with you. Dr. Clark, please respond to that.
Yeast infection is not an STD, right? Yeah. However, women who are sexually active tend to get yeast infection more often than women who are not sexually active. So, for example, there are many women who will tell you, right, that, for example, their husband works on the ship or something like that, right? Yeah. And they will tell you that while he was away, they didn't get yeast infection. But now that he's back and they start to have sex, they get a yeast infection, right? And it's not because he has passed on the yeast infection sexually, right? It's now because with the sex act, you have little abrasions in the vagina. You get little cuts in the vagina, and wherever you break the surface, it is more prone to infection, right? So yes, it can occur in women who are not sexually active, and it can occur in women who are sexually active, and it tends to occur more frequently in women who are sexually active.
Okay.
All right?
I hope that clarifies your point, caller.
Yes.
Thanks very much for calling.
Yeah, welcome.
You're listening to Sex Wise, and this is your late night show. It's called, and of course we have a doctor in the house. Is Dr. Patrick Clark, who is a consultant obstetrician and gynecologist, who is here to answer your calls. You can call us at 974-5051, 974-5079, 974-5043, 618-0352, and 1-888-991-4152. It's really interesting, Patrick, that lady came up with that hypothesis that hypersexuality reduces the frequency of these infections. I mean, it's amazing the kind of myth that people have when it comes to these matters.
Yeah, we need to do a show on myths one day.
Yeah, I suppose we should, yes.
Another popular myth is
there are some rare causes of vaginal discharges, or that perhaps you should tell us about, that are usually warning of something more sinister happening.
You have discharges that, aside from being due to infections, you have discharges that can be due to like foreign body insertion. People put things in their vagina. This usually is a sign of some psychological illness. And often these women actually want attention, and they present to doctors complaining of vaginal discharge. And when you look, you find something inside there, some unusual things. Batteries, for example, you may find inside there.
Batteries,
you may find guinea seeds and that kind of thing.
How do those reach up there?
Well, the women insert them.
As some kind of sort of toys.
Right. Okay. There are some other things that you can find in the vagina sometimes that women may or may not know about. For example, sometimes during sexual intercourse, the condom comes off, and it's not discovered.
Patrick, I mean, batteries in the vagina. No, that's a new one for me.
Yeah, I mean, that must be. There's an actual syndrome, Munchausen syndrome. Okay. It's usually some psychological.
Yeah, Munchausen syndrome. So you're saying, in fact, the women might insert these foreign bodies in order to not necessarily for sexual gratification, but really because they have some kind of mental disorder.
Seeking.
Okay. Right. Okay, so you said foreign bodies can present with abnormal discharges.
Of course, you can have, in addition to infection and foreign bodies, you can have bleeding. You can have vaginal discharge as a result of cancers, malignancies.
Okay.
Right. So women, for example, who have advanced cervical cancer will tell you that they always have a discharge that is very malodorous. In fact, a woman who has advanced cervical cancer, you can actually know she has it many times, even before she takes off her clothes. It has a distinctive smell.
Okay. Could you hold a point for me? We're going to take a short break. We'll be right back.
Hello, good night.
Good night to you, Golo.
My question is that I noticed that I have back pain whenever I want to pass my stool, or even when I'm passing my urine. I have this cramping inside my belly button. Do you tell me what associated with it, or what may cause it?
Sound like you might have an infection in your bladder.
Oh.
Well, that would cause the cramping when you pass the urine.
I have a heavy cramping.
Right, but the back pain when you pass your stool is something different. But it could be a problem in the pelvis. So you need to get that checked out and do an ultrasound.
Okay. But what like if I want to wee or defecate, I may feel the cramping as well in my belly button.
Right, so as I said, it sounds like a problem in the belly button, right? So it could be something that affects both the bladder and the rectum, right? So for example, fibroids would cause that kind of thing. So you need to get an ultrasound done.
Okay.
All right.
Okay.
Yeah, and I have a next question.
Go ahead, Carlo.
Whenever I see my period, it lasts for 5 days, but I have dripping like for another 3 or 4 days. But it's very like pale, or a little bit dark brown. Yeah, that is quite normal in some women. They either have spotting before the period starts, or they have spotting after the regular flow. If it's something that has been going on persistently, it's probably a normal thing for you. Okay.
All right, caller, thanks very much for calling.
Okay, thank you.
All right, you're listening to IFM, and of course we are nearing the end of the show, and we just have time for at least one more call. Call us at 974-5051, 974-5079, 974-5043, 618-0352, and we have a call online. Call, you're the last caller for the night. Welcome to Sex Wise.
Good night.
Good night to you, caller.
Like a few days now, like when I'm taking my bath, I smell like a rotten kind of scent. A kind of rotten scent.
Yeah, okay, Dr. Clark. She has an offensive odor from your genitals?
Yeah.
Okay. How old are you?
21.
21. Any pap smear recently?
No.
Are you sexually active?
Yes.
The first time you had sex, how old were you?
16 plus.
16. At 21, even at 21, it's unlikely that it would be any kind of cancer. So more than likely is an infection in the vagina. So you probably would need to go and get that treated. Something like bacterial vaginosis can cause that, and it's very easily treated by tablets by mouth or by inserts.
Yeah.
All right.
Okay, caller. So if you have this particular offensive odor from your genitals, it's very easy to go and see a doctor. Let him examine you, and he might be able to visually identify what's wrong, or he might want to run some tests on the discharge. And the treatments are quite inexpensive and quite effective. So get yourself sorted out, okay?
Okay, thank you.
Okay, Patrick, it's amazing. Time flies fast when you're having a good time. We have about 2 minutes to go. So just before we leave, just wrap up for me and give the listeners again some advice as to what they can do to prevent cervical cancer.
Right. The most important thing is that you must do your pap smears on a regular basis. We usually say that you should start your pap smears within 3 years of your first sexual encounter. So if, for example, you start to have sex from your 13, then you should start by 16. If you start to have sex at 20, then you should start your pap smears by 23. So within 3 years of your first sexual encounter. And thereafter, you should do pap smears on a yearly basis. There are very few instances where you have to do pap smears more often than once every year. And your doctor will usually tell you about those instances. So if, for example, you are HIV positive, because we know that it may develop quicker in HIV positive women, we advise those women to do pap smears twice a year. If you've had a pap smear before and it was abnormal, then you may be required to come back and repeat that pap smear in 6 months' time. All right? So usually those are the two instances in which you have to do it more often than once a year. Right? But for the vast majority of women, you do your pap smear once a year. Cervical cancer is a very, very slow-growing cancer, and I guarantee that all women who we discover have cervical cancer, late cervical cancer, when you ask them when was their last pap smear, it was more than 5 years ago, right? In many instances, more than 10 years ago. So the take-home message is, if you do your pap smears on a regular basis, starting within 3 years of your first sexual encounter, you will not get cervical cancer. And worst case scenario, if you do get cervical cancer that is diagnosed only by the pap smear, then we can treat it effectively at that early stage to give you a complete cure.
Thank you very much. That was the voice of Dr. Patrick Clark, consultant obstetrician and gynecologist, who was our doctor in the house tonight. You've been listening to IFM, of course. You've been listening to Sex Wise. It has been a pleasure sharing the microphone with you. We'd like to thank producers Joy Morgan and Monique Price, DJ O'Brien, and of course all you, the callers, who have been very actively involved in the show tonight. And of course, to you, our listeners in Jamaica and around the world, thank you for choosing RFM as your favorite station. We wish you a wonderful night, and DJ Chris is standing by.
better to have it and don't need it.
Reggae Radio, Irie.